After thinking about the money, and we need to think about money in this world state, it is good to get back with the brains because we are taking care of the brain injury patients. So, what is the most important work for the brain itself? Can you guess what might be the most important work for the brain itself? I think that you are guessing there's something. And for the brain, it is the most important thing to stay alive, to stay safe. Good, you are guessing there. Maybe the thinking. Yeah, without thinking, nothing happens. Protect COM. Good. Function. I think that I'm saying that the most important work for the brain itself is to stay alive, to stay safe and not fall down. Because if we are falling down, what happens to the brains? If brain is not working, nothing is not working. That's why we need to always keep our brains safe. And that is the most important thing for the brain, to stay alive. And here's the picture from Vasa concept. So in the up there, you can see the normal body, and you can see that the COM is in the middle of the body. But when the patient is having a stroke, then we are going on the right side of this circle, and the first in there. All postural control taken over by the good side. All voluntary actions with good side. Good side compensates the all time. Affected side is compromised all the time. So, the COM gets arrested in safe territory for safety reasons. And of course, the better side of the body is taking care of the COM because you cannot trust the paralytic side of the body. Because you might fall down. Doesn't it make sense that the better side of the body takes care of the COM and the paralytic side of the body is coming follower? So the paralytic side develops abnormal movement. I think that everyone has seen this. Abnormal movements are attempts of the brain to restrict COM movement. And it needs to be restricted because you cannot trust the paralytic side of the body. You may fall down. Remember, the main thing in brain is to stay alive. And affected side is used to put a brake on fluid chains in movement of COM. The COM stays in the better side of the body. So the COM comes like a prisoner, and compensation makes recovery from stroke more difficult. So that's why it is important if we can start to do Vasa concept from the day one. So because of all of these, the affected side of the body becomes a follower, and the good side is leading constantly. But by doing the Vasa concept, you can change this whole picture. But before we are going into that, I would like to know that have you thought about COM before on hemiplegic patients? And how much the COM is affecting to everything. And COM was the center of mass. And when you start to do the Vasa concept, you introduce control on posture using affected limbs. You expand boundaries of COM towards the affected side. Affected limbs begin to control posture and restore COM safety. So the brain has ability to trust to the paratic side of the body. So when the brain is trusting for the both side of the body, COM is no longer prisoner of good side. Weak side gets strong and can restore COM automatically. And then we have automatic exchange of dominance between two sides, and it is possible. And if this picture is too small for you, you can find this picture also from internet. And you will learn more when you're watching that many times and you are thinking this when you are seeing your patient. There's someone in the chat asking that is this COM? Yeah, this really is COM of the body. Center of mass of the body. And now we are getting back to the walking exercises. So, how the hemi walking helps the patient to walk in the right way? If on those exercises the better side is leading and the hemiplegic side is following. So if you continue doing that, leading and following, how you are able to find the medium balance in there. So when you want to find and help the patient to take over the whole body, you need to do this whole thing. The affected limbs needs to control posture and restore COM safety. And here in the center you can read that Vasa concept is to expand the boundaries of COM, center of mass.